Okay, are you fully prepared for back to school? Like, have you considered an eye examination prior to their first day back? If not, I want you to listen up because we think it should be a priority. So I'm Tom from Eye Care Eyewear, and I'm bringing you an evidence-based perspective to behavioural vision care. And by way of background, I've been practicing optometry since 2001, and my practice holds over 25,000 optometry records. In 2015, I was fortunate enough to be accepted as a fellow for the Australasian College of Behavioural Optometrists. And guess who was on my examination board? That's right. I'd like to introduce Sarah Sweeney from RTL's Optometry. So I'm just going to bring Sarah in here now too. Hey Sarah, how are you?
I'm very well, Tom. How are you?
Yeah, I'm great. So I've just got a bit of a frozen screen here. I'm just going to apologise to start with too, because this is one of the first times I've used Ecamm Live, so if there's a bit of problems with the flow of this event, that's the reason why. So let me just switch to my different camera. Here we go. Out, in, and Sarah in, and out. All right, that looks much better. Okay, so Sarah, you started in optics in 2007. You received your Bachelor of Applied Science in 2000.
I think I started in
1997, I got that right. And then you became a fellow of the Australasian College of Behavioural Optometrists in 2007.
Yeah.
And you've served on the Actual Examination Board, as well as being a lecturer and a clinical supervisor of the 4th and 5th year optometry students at QUT, where we both studied, at the School of Optometry. You're the principal owner of RTL's Optometry, which is an independent practice in Brisbane. And from what I understand, the focus for RTL's is to empower patients to increase their well-being by creating a plan to restore vision to its best. I really like that. That's great.
You like that one?
Yeah.
You're reading it. It's beautiful.
You also, I'm in awe. You also recently were awarded the Keith Woodland Award by ACBO for outstanding contributions to behavioural optometry. So congratulations.
Thank you, Tom. Thank you.
So why are we here? Today we want to detail the reasons why it's so important that children have their eyes examined, and hopefully we can create a bit of a unique perspective from two fellows of ACBO about why it's so important and how an eye examination, in my opinion, hopefully yours too, Sarah, can completely change the way in which a child engages with school. If there's any questions during this live, please feel free to put them down, and we can answer them hopefully as we go, or maybe towards the end. So I've got a little incentive to stick around to the end as well. Sarah, you're going to really like this. In the preview photo for this live, you'll notice that there's actually a picture of, I'll just bring it up here now, Sarah with this nice witch's hat, and I just wanted to give some explanation as to why that occurred. So we'll talk about that right at the end.
That'll be really helpful.
Yeah, put a bit of context there, and why we're holding an FL41 flipper as well. We can explain that too. So I'm going to throw you in the deep end, Sarah. I want to ask you, why do you think it's so important that children have their eyes examined?
Yeah. Okay. So I feel that a lot of what goes on in a school environment actually requires your visual system to work well. And a lot of these things are very subtle and can fly under the radar. And in my experience, one of the saddest consultations we have is when we discover that a child in grade 3 or grade 4 has a visual difficulty, and the parent says, "How long has this been there for?" And we say, "Look, it's probably been there their entire life."
Yep.
And it has been making reading and learning difficult for them this entire time. And the parents get so frustrated, thinking, if we'd found this 3 or 4 years ago, they wouldn't have struggled this whole time. So I feel it's about being able to assess and work out whether there are going to be difficulties in the future, and be able to intervene early if that is the case.
Yeah, it's a really difficult conversation to have with a parent too, isn't it, when we actually do find a vision problem like this as well. Because I always think it's always better to look on the bright side. Like we've found this problem, so we have the opportunity now to make a change, which is not going to hinder the child moving forward in terms of their visual development. sometimes these optometric interventions which we can offer, which is the topic of potentially another live, can just make such a massive difference, and the development can be so quick.
Yes.
So, yeah. Look, I think the other thing I wanted to touch on too is that, as a child, we can't really expect our children to have the perspective that we might have as to whether we've got problems. So it's really common for a child to not have a clue. They can't see things as clearly, or that they actually that they're not supposed to maybe, say, focus really hard to see things. So that's a really important sort of thing, I think, that needs to be communicated to parents too.
Yeah.
I wanted to,
I've
so you go.
I've had a case of a child who was struggling to read, and when we started to test them, they were getting double vision almost all the time. So I said to the child, "Do you see two of things when you look at the page?" And the child said, "Yes, I do." I'm like, "Which one do you look at?" The child said, "I just pick one and just look at it."
And
and
meanwhile, mum's like, jaws just dropped and hit the ground.
Yeah, exactly. And it just goes to, it's a case in point that for this child, that's just normal. That's just what I have to do. This concept of double vision is not a concept for them.
Yeah, no, they've just learnt to deal with it.
Yeah.
That's how amazing our brain is in terms of how plastic to be able to compensate for these problems as well. Hey, I've got a couple of things I want to talk about in terms of behaviours that might indicate vision problems. I want to shout out to ProVision for providing these ones, they've been pushing this a bit, but they talked about struggling at school, and we've already sort of touched on that as well. Avoiding ball sports, I thought that was quite an interesting one as well. Like, I can think of lots of patients that I've seen that, will shy away from activities, and oftentimes it's because they're not as confident in their body and spatial awareness. So a classic example would be somebody with, say, for instance, definitely like myopia, say, for instance, if you can't see a ball coming towards you, a fast-moving ball, that's a problem. But even like a convergence insufficiency type problem where children are more likely to have issues with knowing where they are in space, and that makes it harder for them to direct action as well. So that's
exactly. Yeah, so we're often talking to parents about the fact that, look, your child might be able to see really clearly. They can see that ball, it's clear, but as it's moving towards them, they just don't know quite where it is. So they don't get the enjoyment of the contact of hitting the ball or kicking the ball exactly as it should be. And this child is wondering why everyone else enjoys tennis so much and they're just really not enjoying it.
It's maybe a couple of hits to the body or the head as well. So it's not the most fun as well for that poor child. Look, I tell you what, clinicians that have problems oftentimes end up being good clinicians. I've got lots of problems. Most definitely.
Yeah, all good.
Hey, another one was squinting when looking at the board or watching TV. And I just had a child this morning that I saw which had quite a large prescription. I'm talk optometry speak here, but +3 with a -3 SIL, right and left, 180. And it's like, it's no wonder that this poor child has been squinting pretty hard to be able to see things because they've just had these problems. Yeah, I think it goes without saying too that there's a couple of, I would sort of break it down into 4 main areas that needs to be sort of conducted in an eye examination. The first one is to determine if there's any ocular disease. So this is the domain of every single optometrist out there. We're all pretty good at doing that, aren't we, in terms of working out if there's ocular disease. I would go a little bit further to say some of the new pieces of equipment that I use, like an OCT, will enable me to determine if there's any sort of developmental delays, like maybe some, again, I'm talking optometry speak here, but foveal hyperplasia. So if there's some problems with the macula not developing properly, and it might be associated with amblyopia or not being able to see quite as clearly. So that's some really good things for us to look into.
Yeah.
Another thing is
saying that, you can pick up lazy eye or lazy eyes or turned eyes. You might be able to actually see that clinically, measure it.
You can,
with equipment now.
That's right, yeah. And that's sort of, these pieces of equipment have been around for a while now, but I think that having the background with being able to look for having the awareness of how an eye works makes it easier for us to examine these things as well.
Yeah, so we can actually use it in a different, off-label use.
Yeah, exactly. Yeah. Another one would be refractive error, obviously. So that just refers to if your eye is, say, too long or too short or misshapen. So that's a really important thing to do. Also, the difference between the two eyes. That's a really important for us thing to work out. We call it anisotropia.
It's brilliant.
Yeah. And then this sort of moves into another area which I'm sort of more passionate about, and I'm sure you are too, Sarah, and this is the problems with visual efficiency and then the problems with visual perception. So visual efficiency, like I often say to my patients, it's more important, if not more important than the refractive error. Like really, if you've got poor visual efficiency, that's what's driving these changes sometimes. So it's really important to get a really good assessment of people's visual efficiency. Now,
Yeah.
what do you think by, like, how would you describe visual efficiency as for everybody else out there, Sarah?
I think I like to give people the example that they're probably almost all experienced. If you are reading before you go to bed and you're reading the words and they're clear and you can still see them, but you will have read the paragraph and then you can't recall what you read. At that moment, there is nothing wrong with your sight. Your sight is perfect, but the amount of energy that is required to actually keep your eyes aligned and keep them moving and keep it focused is taking so much energy that you haven't got any energy left to concentrate on what you are doing.
Yep.
And that's an experience I feel everybody has gone through. Now, the advantage of being an adult is that if I am reading before I go to bed and I'm tired, I can just shut the book and go to sleep. But your poor little preppy or grade 1 or grade 2, they don't really have that option. They've got a whole day of schoolwork to do. And so for them, then we move into these other behaviours like avoidance and fatigue and eye rubbing and sometimes, mucking up and behavioural issues as well. I agree with you. Visual efficiency is kind of this, I feel it's massively underrated. In optometry world. When you start testing people's visual efficiency, I'm often saying to them, how are you going in front of a computer all day, every day? And they're like, oh, I hate it.
Yeah, it's my favourite thing, like.
Yeah, exactly.
Prefer to be outside doing something maybe. Yeah, definitely.
Exactly.
I mean, this is a lot of our life choices sort of are probably determined by our visual efficiency profiles. That's how I look at it, really. And then I suppose that leads into visual perception and development of visual perception as well. And like again, another topic for another live, but I think that visual perception testing is just so important for me. It's just one of those barometers that I can use because sometimes it's really hard to get accurate efficiency and visual acuity, just standard visual function assessments, whereas the visual perception assessments enable us to sort of take a step back and look at correlations between fine motor control as well as they're wonderful tests. How do you find you use your visual perceptual tests, Sarah?
So I feel they're really valuable in terms of getting this whole picture of the person. One of my favourite things to explain to people is that you don't see with your eyes, you see with your brain. And so even though you've got perfect eyeballs, if your brain is not understanding the signals that are coming in, you actually misread the whole world. So, we give examples of you may not be able to remember the word that you just read on the page before because you're having difficulties with remembering the things that you are seeing. So again, I feel like this is a massively underrated area in optometry, but when you start testing for it, it starts to explain a lot of these really funny, quirky symptoms that we're seeing in children that sometimes we think it's just because they're not trying hard or they're not concentrating. Maybe it's the other way around. Maybe they're trying really hard and they're concentrating, but because these skills aren't developed well enough, they just don't want to do it anymore.
And I really see them too, when I try and explain it to a patient, as like a building block. Like if you think about your foundation sort of skills, like some of these visual perceptual skills, I'd regard them as being foundation. And if you haven't developed them as well, then it makes it much harder to develop those higher order skills, which are responsible, which is sort of what a lot of school is aimed at, to be honest. Like a lot of the reading and understanding things is way beyond where a lot of these kids are at their developmental levels. So yeah,
good point.
Hey, I've got some shocking statistics to throw in here too. Again,
ready.
Just brace yourself. Again, thanks to Provision for this, and that is, and this is one that gets thrown around a fair bit, but 1 in 5 children have an undetected vision problem. Pretty common. Like there's a lot of kids out there.
Yeah, it's a lot.
That children rely on vision for 80% of their learning in their first 12 years. So, like, I think that sort of, when you think about learning, it sort of starts off with using a lot of the other senses, and then vision sort of dominates and becomes the predominant sense. And I think it just goes to show that, you know, having problems with your visual system, which can often appear hidden, can be just so detrimental to your ability to acquire information.
Yeah, absolutely. And I think, especially in that prep year, especially if a child is stuck in that very tactile place and they're not using vision as their dominant sense, they really struggle to learn because everything is presented fairly visually. So it just leads back to, why do we want them tested before they start school? Because we need to know whether they're at a place where they can use their visual system yet. If they're still back using their hands, then when the teacher's on the other side of the room talking to them and I can't touch the teacher, it's really hard for them to concentrate. So the test before school is really critical.
It just reminds me of a patient that I saw recently, and I said to the mother, I said, so Lily going to use little Johnny, do you notice that he tends to put a lot of things in his mouth all the time? She's like, oh, really? What are you talking about that for? I mean, you know, when you think about it, like, yeah, you're amazing, Tom. How did you work that out? Like, no, it's just a pattern of the way that kids develop, and he hasn't developed out of that particular step there. So, yeah, no, look, definitely, I think that there's a lot of those building blocks that need to be developed first before the children move on.
Yeah.
I got a couple of other shocking statistics from thanks to Cooper Vision Now, and they did a study, a consumer perception survey. It was basically geared around myopia in Australia, but they found that 31% of Australian children have never had an eye test. Like, that just sends a shiver down my spine. Like,
it makes all optometrists just go la la.
Yeah, exactly. I don't want to hear it. I mean, there's states in America where apparently it's obligatory for you to have an eye test before you enter prep. So, that's just scary. And another statistic was that 44% of Australian children have not had an eye examination before their 9th birthday.
Yeah, it's not right.
And I mean, it's not that we, like, as I said, I've got to look at the glass half full. It's not that we've missed, if they're having eye tests after that point, we haven't missed the boat. We can still do a lot of work, but it's so much nicer if we can get them earlier, isn't it?
Exactly. So the earlier the intervention, the less likely we are to create other issues that then need extra attention with. So the earlier we intervene, the better. I completely agree.
And that leads me to the issue that is so prevalent, maybe a little bit more in the city than where I practice, but that's myopia. So, like, when you see kids that have developed myopia, it's like...
By that you mean short-sightedness?
Yeah, exactly. So myopia meaning that you can't see things clearly in the distance. Thanks for clarifying that, Sarah. I appreciate it. Can't see things clearly because basically your eye has been stretched. And the way I look at it, it's from a lot of strain on your eyes for many, many years. I'm unfortunately quite short-sighted, and I know that potentially if I had been seen a bit earlier, I wouldn't be as short-sighted as what I am now. So, you know, I've sort of made it a personal thing of mine for many years to make sure I stop as many people as possible from becoming myopia. And this is a real buzzword at the moment. It's called myopia control. And yeah, I'm going to put it out there. I'm going to say that behavioural optometrists have been doing myopia control for years. Like, that's what we do. So yeah, like, I think it's really, really important. And myopia, why is it so important? I say this is the bit where it's sort of like, it can get a bit scary for some people, but you know, if the earlier a child starts with myopia, the greater the chance they have of developing high myopia. And there are sight-threatening conditions or ocular pathologies that can occur from myopia. So things like retinal detachment, myopic macular degeneration, cataracts, and glaucoma. So I know that sounds a lot, but basically that means you won't be able to see properly if you've got those problems. And I say to patients, look, it's not going to be a problem for you now. It's probably not going to be a problem when you're in your teens or maybe even your 20s. But if you want to see from age 60 to the rest of your life, you need to do something about this now.
Now, absolutely. Because that's right. By the time they get to the age of 60, there's just been so much, I think, pressure on that poor eyeball. There's actually not much we can do to reverse it at that point. We're just at a place of management. We can't actually heal it. So, yeah, early intervention, really, really good.
Exactly. No, I agree. Another one too, I'm going to shout out to Paul and Kate Gifford, because they have done some studies as well as studies, and there's one that they did called The Future of Myopia Control with Contact Lenses. And they found that, sorry, let's move it back again, 90% of parents are not aware that the role of excessive screen time, TVs, computers, mobile phones, can play a role in the prevalence of and progression of myopia. So, like it's sort of one of those things that like we might say that, and we know that that's the case, but 90% of parents are not aware of that. So I'm hoping that somebody's listening to this, and we've just moved it to, 89 or maybe 88%, like just a few less will now become aware of that.
Yeah.
I'm also going to shout out to Kate and Paul for their amazing website that they've got, which is the Myopia Profile website. It's incredible. So that's www.myopiaprofile.com. If you're interested in finding some information about myopia and how it works, that's the place to go. Okay, so another thing I just wanted to quickly touch on, I don't know if this is maybe because of the issues that I had with my learning when I was younger, Sarah, but I get this confused between vision-related learning problems and learning-related vision problems. So what are your thoughts about vision-related learning problems and learning-related vision problems? How do you see those? Because so I see it as like...
Can I give a pass?
Yeah. Well, you did. You did pass me.
Right.
No, I think I've got it under control. So basically, the way I see it, like a vision-related learning problem is associated with a poor academic performance because of a lack of development with the visual system. So poor visual efficiency, right? So that's because it's vision-related and it's a learning problem. Whereas I see a learning-related vision problem is more likely to be like myopia. So a stress-related response that occurs because you're trying to learn and you can't learn properly.
Yeah, that makes more sense.
How'd I go?
You've done very, very well, Tom. Yeah, and I completely agree. But I think that just even working through these definitions, we can see how critical vision is and what a massive part it plays in learning. And I've been speaking to a friend of mine who was doing a master's of teaching, and she said, I'd never even thought of vision as being a reason why people might have difficulty reading. And the statistics that you said before, where up to 80% of the information we get from the world is through our visual system. Vision is critical to learning and especially reading.
Yeah, that's crazy, isn't it?
Yeah.
Okay, so let's provide a little incentive now. I'm just going to switch back so we can see our little image here.
Thanks. Yep.
Yeah, no, that's all good. Okay. So,
yep, got my back there. Great.
Yeah, so for those, there may actually be some people out there that recognise that image because we did a little live, didn't we? It was right back in May of 2018, and it was because we were giving the highlights of the 2018 International Congress of the Behavioural Optometrists, so ICBO, and it was the last day. And the reason why Sarah was wearing a witch's hat was because we had a Wizard of Oz theme, wasn't it?
Yes.
Now, I'm assuming that you're one of the evil witches as opposed to the wicked witches.
Sorry, is there a difference?
Yeah, I'd have to go back and revisit my Wizard of Oz, but yeah.
It could be a bit of column A, a bit of column B, yeah.
And if you look really carefully, you'll probably notice too that I have like a little, medallion sort of hanging down from my shirt just there. And that was my my medallion of courage, because I was trying to be like the Lion of Courage, because I was actually really worried about that particular live and getting really nervous about it. So I thought I'm going to get a courage badge just to help me. So I think it helped.
Yep.
The
other, wear one of those next time.
Yeah, okay, definitely. The other thing which I found was I find quite amusing about that image was the fact that we're sharing a microphone. And because it was way back in the infancy of my live production, and you can see it hasn't actually progressed that much further, but we attached the microphone to a FL41 flipper. So these are flippers that we use at work, and so I just thought I'd switch it back and forwards, and that was a microphone. And that was a step up.
MacGyver, aren't you?
Yeah, well, definitely. But that was a step up, because the first one we used was a hairbrush. Remember our microphone was the hairbrush? Yeah, we've got lots of comments about that too.
Yep.
So
We've come a long way.
Yeah. All right, listen, let's wind this up. I want to thank you, Sarah, so much for attending and helping me bounce some ideas about this. I want to thank all the viewers out there for watching. Please let us know if you have any comments about this live, any questions. And look, I think I was going to just save this towards the end just to make sure this actually all worked out properly. But I would like to do another one of these lives, maybe next week, if that's okay with you. And I was thinking what we'll do that time is we could discuss what happens in a comprehensive eye examination and how this in particular differs from a visual screening. Because there is a bit of a misconception out there that, hey, my child's had a test. They had a test when the school nurse came along, and they're fine. They don't need to get their eyes tested for the next 30 years. Yeah.
No. Yeah,
it doesn't work like that, does it?
Very important discussion to have. Yes.
Awesome.
Good idea. I'm in.
Okay, Sarah. Awesome. Thanks for everybody. Thanks for watching, and we'll see you next week.
See you. Bye.
Bye.